Hello, my name is Dr. Michelle, and I want you to know that all toothbrushes are not made equal. But I also want you to know that there is not just one toothbrush that I recommend for every person, for every mouth, for every need. There really are individual reasons that you're going to choose one over another. And honestly, this choice is so important because your tooth health, your gum health, sometimes even your gut health and overall health is going to be dependent somewhat on the toothbrush that you use to take care of your teeth and gums. So let's get into it. What kind of toothbrushes are there? What should you be using? And how do you really make this choice? There are two main categories of toothbrushes that we're going to talk about. There are electric toothbrushes and there are what we call manual toothbrushes. You probably have used some of both of these, but let's talk about the different kinds and why you would choose one over another. First of all, let's start with manual. That's the kind of toothbrush that we are all very familiar with. We've probably been using it since we were a little kid. The key with a manual toothbrush is the bristles. First thing that you always have to make sure of is that any bristles that you're using on any toothbrush are soft. So if you see a toothbrush in the store that has medium or hard bristles, you are never going to use that in your mouth. The only purpose for harder bristles than soft is to clean your toilet or scrub the oil off your driveway. That's it. If it goes in your mouth, it needs to have soft bristles. Now, the size and the shape of the bristles is a little bit determined by the size and shape of your mouth. If you have a big mouth, then you can use a brush that has a larger head on it. If you have a very small mouth, then you may need to choose a toothbrush that has a smaller head based on just what you're trying to fit. For example, if you have a small child, you're not going to put a great big toothbrush in there. It's not going to conform to their teeth, to their mouth, to the way that they need to be able to brush. So that's the first key about a manual toothbrush is soft bristles and the size and the shape that actually fits in your mouth. The next key is how do you use this? Most people think that they should use it just straight on their tooth like this. The problem with straight on your tooth is you're only getting about half of what you need to be cleaning. The way you use a manual toothbrush is you angle the bristles slightly upward toward the gum. So on the top teeth, it's going to be slightly upward. On the bottom teeth, it's going to be slightly downward. You want the bristles at about a 45-degree angle toward the gum line. When you are on a tooth, you're going to position that brush on the tooth at that 45-degree angle like we talked about, and you're going to vibrate like this. Very little vibrations. You're not doing big, broad strokes like this across the teeth. Why? Well, first of all, the big, broad strokes are going to skip a lot of the in-between spaces that the bristles need to get into. But the second reason is that can be really damaging to the gums. Those big, broad strokes can hurt some things. So you're not going to do any of that. You're going to put it at a 45-degree angle right up against the gum. You're going to vibrate back and forth and then sweep it down or sweep it away from the gum. So on the bottom, you're going to sweep up, top, you're going to sweep down. 45 degrees, we're going to show one more time. You're going to move it to the next spot. Vibrate, brush it down. And what you're doing is you're allowing those bristles to get in between the teeth. You're allowing them to get underneath the gum slightly, gently vibrating, and then bringing all of the bacteria, plaque, everything that's sitting there down and away from the tooth and the gum. This is so important if you're going to keep your teeth clean. You have to do this the right way. So you're going to just work your way around, and you can see the size of the bristles is how far you're going to move to the next stroke. So you're going to go here, 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 and you're going to do that small vibration and then sweep it down, or a small vibration and sweep it up if you're on the bottom. If you're using a manual toothbrush, this is absolutely crucial. You are not fully cleaning your teeth unless you do this. So you do it on the front and the back of the top and the bottom, and then you go along the chewing surface and also brush those clean. The next question people always ask is, should I use an electric toothbrush instead of a manual toothbrush? The answer is not if you're going to use a manual toothbrush correctly. If you're going to spend the time to go through and vibrate, sweep all the way around, then you're going to do a fabulous job with this toothbrush. My dad is a dentist, and growing up, I would actually ride to school with him because my school was near where his office was. So I would always ride to and from school with him. He had toothbrushes in the side pocket in the car. And on the way to school and on the way back, and honestly, most places he was going, he would be brushing his teeth. He's very tall and he has very long legs, so he would steer with his knees. You know, I know this is probably not what you all want to hear, but he brushed exactly the way I just showed you. He would vibrate, swish, vibrate, swish. You could hear this while you're driving to school. I'd hear this noise, vibrate, swish, vibrate, swish. His teeth were meticulously clean. He was doing a fabulous job. If you don't want to spend that time, you're going to choose an electric toothbrush. So let's talk about the advantage of an electric toothbrush. All of that vibrating, you don't have to do. It's doing it for you. So when you position this on your tooth, you're going to angle it the same way, 45 degrees. It's going to do the vibration for you. You still want to take it away from the tooth, but it's really going to cut down to about half of the work that you are having to do with a manual toothbrush. So a lot of people just say, I'm just going to use this. It's going to make it easier. I'm going to probably do a better job. Again, though, it only does a better job if you hold it the right way and position it the right way on the tooth. If you just start doing this with this manual toothbrush again, you are missing so much of the teeth. You position it, let it do its job, bring it down. Position it, let it do its job, bring it down. And you're gonna do this. This is honestly another reason why I don't love toothpastes that foam. Because once they get foamy, you get a mouthful and you go, I think I'm kind of clean and I think I'm done. You're wrong. That's why the toothpaste and the tooth powders that I recommend don't have a foaming agent in them. We want them to keep cleaning without your mouth filling up to the point that you have to spit and you think, I'm done, everything feels pretty darn clean. No, you need to be touching every tooth as you go around. So there are different types of electric toothbrushes. There's a lot of controversy and a lot of marketing angles around this. Which one is better? Which one is not? Honestly, a lot of it is personal preference again. So the Oral-B type toothbrush is what we call an oscillating and a rotating toothbrush. So the head does this. So the mechanical movement is actually what cleans the tooth. Often these heads are round, which makes them get a little easier up to the gum line. So if you have gum disease, but your gums are pretty tough, they're not very thin, you don't have gum recession, an Oral-B toothbrush is going to be great for you because it's going to clean really effectively. And as it gets up against the gums, you're not going to be as worried about damage because you don't have receded gum lines, you don't have uncovered root surfaces, and Oral-B is great for just overall toothbrush. There's a second kind of toothbrush called a sonic toothbrush, and it vibrates for you, and it vibrates at a sonic speed, so it's very, very rapid. That sonic speed disrupts the plaque, disrupts the bacteria, all those things on the teeth. So when you put it here, it's going to be able to do that vibration motion for you. It's not rotating, it's vibrating back and forth. Some of these have quite a large head, so they may not be the best for you if you can't fit them in your mouth. Sonicare is one of those kinds. It has a larger head. It looks a lot like just a manual toothbrush. It may fit great in your hand, may fit great in your mouth, and it may be the one that you love to use. There's one that I use actually in my own mouth for a few reasons called Burst. This toothbrush is a Burst toothbrush. It is a sonic toothbrush, but what they've done is they've softened the bristles. So the bristles are very fine, very, very soft, so they can speed up the vibration. What does that do? It breaks that bacteria and plaque up even more. So the speed is greater because the bristles are softer, and it almost feels like they're just kind of brushing against things. I quite like it because I tend to have a little thinner gum, a little sensitive tooth structure. I don't want to really be hammering it with a lot of moving and rotating and that kind of thing. I just like the real soft bristle and the real rapid vibration. In my hands and in my mouth, this does a great job. So what are those deciding factors? How are you going to choose which toothbrush to use? First of all, you're going to determine it by what are you trying to achieve. Do you struggle with cavities? Do you struggle with gum disease? Those are the two biggies. Do you struggle with sensitivity? We'll talk about that in a second, but the two big ones that we're working on are cavities and gum disease. Which is going to be better for those two things? If you're using a manual toothbrush the correct way, if you're cleaning every surface of your tooth, it's going to be fine for either gum disease or cavities, but you have to use it correctly. If you are not wanting to put in the time and the effort and, to do all that vibrating that I showed you, then you probably need to move to an electric toothbrush. If you have cavities, an Oral-B is a great one to get in between. It rotates, it kind of cleans all those surfaces and the nooks and crannies. If you have gum disease, I'm going to actually recommend one of these sonic toothbrushes that vibrate. And like I said, I love the Burst because it's very, very soft, very delicate on gum tissue. That's the first determination. The second thing is sensitivity. How much sensitivity do you have with your teeth? You can remedy this, and my tooth powder, my sensitive tooth powder, is amazing at actually decreasing sensitivity. But if you have sensitivity, you may not tolerate these electric toothbrushes. They may be too rapid for you. So you're gonna have to go back to that manual toothbrush, and you're gonna have to use the tooth powder and really get it into these nooks and crannies. And eventually you can move to one of these highly sonic toothbrushes like a Burst that's very, very soft. So that's the second indication. The third thing that you want to think about is just, what do you want to do? How much time do you want to spend? How detailed are you in the cleaning of your teeth? So if you really want something that's going to get into every nook and cranny and do it in the fastest way possible, I would go for a sonic type toothbrush. It's going to get under the gum, it's going to get around to the teeth, it's going to get everywhere and really do a great job for you with the least amount of effort on your part. I have a story that I want to tell you about electric toothbrushes. I have a patient who, she had a stroke, and she was in her probably late 60s at the time, which meant that she had some years she was still going to be living. Her family was really concerned because as part of her stroke, she lost a lot of dexterity in her right hand, and she was right-handed. And brushing her teeth became very difficult to do. She just couldn't hold the toothbrush, and she certainly couldn't do all the vibrations and things that we talked about. So I told her family she absolutely is going to have to use an electric toothbrush because there's no way she's going to be able to use a manual toothbrush for many reasons. Number one, this handle is just very narrow. It's very hard if there's arthritis in a hand or dexterity issues. You're just not going to be able to do what you need to do to keep teeth clean with a manual toothbrush. So most of the electric toothbrushes have a broader handle. They're easier to hold for a hand that's arthritic or that has some problems that have been created with strokes and other issues. So from just a use standpoint, she needed something that was bigger. She also couldn't do all the vibration and all the action that had to happen with a mechanical toothbrush. So we did recommend one that was a sonic toothbrush that she could just put in her mouth and let it do its job. Now, this is the amazing thing, is she lived for about another 15 years after having that stroke. We did have to do some initial dental work to help protect the teeth and cover them, but she only had one additional cavity the entire 15 years that she lived after having that stroke, and I attributed it 100% to the fact that she was using the right brush for the right indication. She was able to keep her teeth clean even with her challenges. So this is why we talk about the different kinds of brushes for the different uses. So these are all things to think about. Again, like I said at the beginning, not all toothbrushes are made equal, but there's not just one toothbrush that I recommend for everybody because every situation is slightly different. What is it that you're trying to take care of? What do you prefer from a handhold, work standpoint, and how sensitive are your teeth? Take all these things into consideration. So important to be cleaning your teeth the right way. This is how you keep your teeth healthy. This is how you keep your gums healthy. This is how you keep your body healthy. So toothbrushes matter. If you want all of this information plus more in an easy to access source, please request our tooth care guide. This is going to walk you through selection of toothbrushes, the things you should put on your toothbrush, how to clean between your teeth, all of those things together so that you can keep your mouth healthy and keep you healthy.